Hi everyone, in this video I will be teaching you how to pass your Ghana Armed Forces medical examination with ease. I will be giving you a detailed explanation of each of the tests and tips on how to pass each of your medical tests without any difficulty. So without wasting much of your time, let's dive right into it. So after documentation for medicals, a text message will be sent to you informing you about a particular date to report at the health facility to start with your medical evaluation. The Ghana Armed Forces mostly conducts its medicals at the 37 Military Hospital in Accra, Ghana. At the time of making this video, the medical fee is 800 cedis for males and 850 cedis for females, so prepare before you go. The medicals is not conducted in a single day. It can take anywhere from 1 week to about a month, so come along with extra money for accommodation in case you don't reside in Accra. Now, the medical consists of different tests, and I will be breaking down each of the tests into details. So the tests are height, weight or chest measurement, 2. BP, 3. ECG, 4. Audio, 5. Eye, 6. X-ray, 7. Physicals or body selection, 8. Blood test, 9. Pregnancy test for females. And the last test is dentals. Now take note that on the first day that the medical fee payment is made, a group will be shared, usually a WhatsApp group. Each recruit will be given a serial number and put into a particular group. Now the group will be called individually to do their medicals as a group, but the groups will complete at the same day. Now I will advise you to do a personal checkup at home before you actually start with the final medical examination. This is because you will get to know any problem and solve it in time before you start with your final medical evaluation. Now, with that out of the way, let's dive into details each of the tests. Test 1. Height, weight and chest measurement. Here your height, weight and chest measurement will be taken and recorded. The required weight measurement ranges from a minimum of 1.68 meters for males and 1.57 meters for females, but for military police only, the minimum height is 1.75 meters for males and 1.70 meters for females. Test 2. Blood pressure. Here an instrument called a sphygmomanometer, which is often referred to as blood pressure cuff, will be wrapped around your upper arm and inflated to stop the flow of blood in your artery. This will be used to measure your blood pressure. Take note that the normal blood pressure is less than 120 over 80 millimeters mercury, so do regular checkups and take good care of your health. And now relax when your BP is being checked. Test 3. ECG, also known as electrocardiogram, is a simple non-invasive test that records the internal activity of the heart. This helps diagnose certain kind of heart diseases such as heart attacks and many other heart-related diseases. Now, during the ECG test, an electrical wire will be placed on your chest, hands and legs to measure the electrical activity of your body. Don't panic, it will not shock you. Test 4. Audio test. With the audio test, you will be placed inside a small soundproof structure or room, and a headphone or a headset will be placed on your ears. After, a clickable switch will be given to you. This is how the audio test is conducted. A sound will be played at irregular intervals, so whenever you hear the sound, you quickly press the switch. The sound will be gradually fading away or fading out, so stay alert and press the switch as hard as you can quickly whenever you hear the sound in each side of your ear. This test usually takes about a minute to complete. Test 5. Eye test. Now with the eye test, you will be placed inside a room where there will be a series of alphabets or numbers, and you will be asked to close one eye at a time with your hand and pronounce the alphabet or numbers you see on the screen. Same will be done for the other eye. Now, don't press too hard on your eye when you place your hand on it, otherwise your vision will be blurred. Test 6. X-ray. Here you will be placed inside a room and you'll be asked to place your chest on a flat panel machine for a few seconds. The X-ray will scan your chest for any broken ribs or any bone-related illness. Quick tip: don't wear any metal chain or object under your shirt, otherwise it will affect your X-ray scan and you'll be asked to take the X-ray again. Test 7. Physicals or body selection. Here you will be called as a group, usually about 50 people at a time, into an inner room where you will be asked to remove all your clothes. For the males, you remove everything including your boxers or panties. But for the females, you remove everything with the exception of your panties or brassiere. Now, the prescribed underwears are white plain boxers or panties and white brassieres. No colors or black underwears, only white. Now with the physicals or body selection: tattoos, double ear piercing, flat foot, hernia, skin diseases, waist problems, and many more other diseases will be checked. So make sure you solve any of this problem before the day of the physical test. Test 8. Blood test. Here a sample of your blood will be collected and processed to check for any diseases such as HIV/AIDS, hepatitis, sickle cell, and also your blood group will be checked. Test 9. Pregnancy test for females. Now for the females, you will be checked for any sort of pregnancy before going for training. So if you are pregnant, then sorry for you, you will have to deliver before there might be a chance for you to go for training. Test 10. Dentals. Now with the dentals, a dentist will examine your teeth and check for any sort of tooth cavity or tooth decay. Now if there's any of such dental problem or issues, you will be asked to go and solve it in any public or private hospital and come back with a receipt, and they will once again check your teeth if you have actually solved it before they will pass you at the dental stage.